Do you know that something as simple as the color of your urine can reveal important information about your health? Often overlooked, your urine can tell you more than you think about your kidney function, hydration levels, and even potential health problems. So, next time you visit the bathroom, take a moment to observe, what color is your urine? It might not just be a sign of hydration, it could also be a signal about your kidney health, or even something more serious. In this video, we're breaking down what different urine colors can mean and how you can ensure your kidneys are staying healthy. And stay tuned, because some of these signs might surprise you. What should your urine look like? Let's start with the basics. The color of your urine can vary, but ideally, it should fall somewhere along the yellow spectrum. Healthy urine generally ranges from pale yellow to dark yellow. But here's the thing, urine gets its yellow color from a compound called urochrome, which is produced when your kidneys filter your blood. The more hydrated you are, the clearer your urine will look, as it dilutes the substances your kidneys excrete. But here's an important point, urine that's too clear may actually be a sign that you're overhydrated. Your kidneys work to maintain a balance, and drinking too much water can dilute electrolytes, which is something to keep in mind. However, darker hues of yellow, amber, or even orange could indicate dehydration, while other unusual colors could be signaling something more serious. Let's dive deeper into what different urine colors can mean for your kidney and overall health. 1. Pale yellow, your kidneys are hydrated and happy. If you notice your urine is a light, pale yellow, congratulations, your kidneys are functioning properly, and you're likely well hydrated. This color indicates that your kidneys are filtering and excreting waste effectively, and your fluid levels are just right. When your urine falls within this range, it's a good sign that your kidneys are able to regulate water balance without issue. However, it's important to keep in mind that hydration needs vary from person to person. Factors like age, activity level, and climate can all influence how much water your body needs. But in general, aiming for a pale yellow hue is ideal for optimal kidney health. If you're drinking lots of water and you notice that your urine is completely clear, it may indicate that you're drinking more than your body needs. Although this isn't dangerous, it's something to consider, as excessive water intake can dilute your blood and electrolytes, leading to potential imbalances. A good rule of thumb, if your urine is pale yellow, you're likely on track. 2. Dark yellow or amber, a warning for dehydration. What if your urine starts turning darker, like amber or even honey-colored? This could be a sign that your kidneys are trying to hold on to water due to dehydration. The darker the yellow hue, the more concentrated your urine is, indicating that your body is conserving water because it's not getting enough fluid. Dehydration can be caused by many factors, including not drinking enough water, excessive sweating, hot weather, or even illness. When you're dehydrated, your kidneys reduce the amount of water excreted, which makes the waste in your urine more concentrated and darker in color. If you're noticing that your urine has a darker yellow or amber tint, it's time to drink up. Besides the color change, dehydration can also cause symptoms like dry mouth, fatigue, and muscle cramps. To keep your kidneys functioning well, aim to drink between 1.5 to 2 liters of water daily. If your urine continues to be dark despite increased water intake, or if you experience additional symptoms, consider consulting your doctor. 3. Orange or darker shades, possible liver or bile issues. If your urine turns orange, it might not be just a result of dehydration. While dark yellow typically indicates dehydration, orange urine can sometimes be linked to liver or bile issues. Certain medications, like antibiotics or pain relievers, can also cause your urine to turn orange, as can consuming foods like beets or carrots, which are rich in certain pigments. However, persistent orange urine without any dietary changes could be a red flag. It's important to consider whether you've been taking any medications that could be causing this discoloration. For instance, phenazopyridine, used to treat urinary tract infections, can turn urine orange. If orange urine persists and is accompanied by other symptoms like jaundice, yellowing of the skin or eyes, nausea, or pain, it may be a sign of liver or bile duct issues. In such cases, it's crucial to seek medical advice, as these symptoms can indicate underlying conditions like hepatitis or gallstones. 4. Dark brown or tea-colored, a potential sign of severe dehydration or liver trouble. If your urine looks dark brown, like black tea, it's important not to ignore it. Dark brown urine can be a sign of severe dehydration, where your body is trying to conserve water to the point that the urine becomes very concentrated. However, if you're properly hydrated and still notice this color, it could indicate liver issues, such as cirrhosis or hepatitis, which affect how your liver processes bilirubin. This color can also appear if you've eaten certain foods like fava beans or rhubarb, which can temporarily tint your urine. However, if it's not related to food and persists for more than a day, it could indicate a more serious issue that requires immediate medical attention. Dark brown urine could also indicate muscle breakdown, a condition known as rhabdomyolysis. This occurs when muscle fibers break down and release toxins into the bloodstream, which can eventually affect the kidneys. If you're experiencing this color along with muscle pain or weakness, it's crucial to consult a healthcare provider right away. 5. Red or pink, blood in your urine. Red or pink urine is often alarming, but it doesn't always mean something serious. Sometimes, it can simply be caused by eating certain foods like beets, blueberries, or rhubarb. In such cases, the discoloration is harmless and will disappear after a day or two. However, if your urine is red or pink and you haven't recently consumed any of these foods, it could be a sign of blood in your urine, a condition called hematuria. Blood in your urine can be caused by a number of factors, including urinary tract infections, UTIs, kidney stones, or even bladder infections. While blood in your urine isn't always a sign of something serious, it should not be ignored, especially if it continues over multiple urinations. You should consult your doctor to determine the underlying cause and rule out any potential health conditions. 6. Blue or green, a rare, yet intriguing color. Blue or green urine is a rare occurrence, but it's not always as alarming as it seems. Certain medications, such as the chemotherapy drug methylene blue, can turn urine this color. Some foods like asparagus and certain artificial dyes in candies or drinks can also cause this unusual urine hue. In some cases, bacterial infections in the urinary tract can lead to green-tinged urine, especially if a specific strain of bacteria, like Pseudomonas aeruginosa, is involved. This bacterium can produce a greenish pigment, which might appear in your urine along with other symptoms like a burning sensation during urination or a foul odor. If you notice blue or green urine without any obvious cause, or if it's accompanied by symptoms like fever or pain, consult your doctor to ensure it's not due to a urinary tract infection or other health issues. 7. Cloudy or foamy urine, what does it mean? Cloudy or foamy urine can sometimes signal that something's wrong with your kidneys. Cloudiness in your urine could be due to the presence of pus, bacteria, or mucus, often caused by urinary tract infections or kidney infections. Foam in urine, on the other hand, can sometimes indicate high levels of protein, which might be a sign of kidney damage or kidney disease. Protein in the urine, also known as proteinuria, is often an early sign of kidney dysfunction. If you notice persistent foamy or cloudy urine, it's important to see your doctor. Kidney disease can progress silently, so early detection and intervention are key to preventing further damage. So, what does the color of your urine say about your health? From hydration levels to potential kidney problems, your pee can reveal important insights. Keep an eye on the changes and always listen to your body. If you notice anything unusual or persistent, don't hesitate to consult your healthcare provider. Thank you for watching. If you found this video helpful, please give it a thumbs up, share it with friends, and subscribe to our channel for more health tips and wellness advice. Don't forget to leave a comment with your thoughts or questions below. Stay healthy, stay hydrated, and take care of your kidneys.